I'm Obi Warwood, and welcome to Access to Healthy Living, a program designed to educate and inform Montgomery County residents on today's health issues. We are at City Place Mall in Silver Spring in collaboration with Fit Solution, hosting the 6th annual Healthier You Fit Kids Health and Fitness Expo. Some of the topics we will be discussing on today's show will include breast cancer, obesity, nutrition, stress, HIV, heart disease, prostate cancer, and fitness and finance. So you certainly want to stay with us for good information you could use right here on Access to Healthy Living. Joining us is oncologist Dr. Regina Hampton, obesity expert Yusef Battle, registered dietitian Sharon Hawks, and cardiologist Dr. Robinson. Thank you all for joining us today. Thank you. I'm going to start with you, Doctor. Tell us a little bit about breast cancer.
Well, the first thing that I want people to know is that breast cancer in the year 2009 is not a death sentence. Breast cancer is very treatable, especially if women are doing their self-exams at least once a month, getting their mammograms. And I think we just have to get the word out that breast cancer is very treatable. There are some startling statistics when we talk about black women versus white women. Black women get breast cancer less than white women. However, we die at a higher rate. And I think that with doing some of those things I just talked about, we can get those rates to be more even.
And at what age should a female start doing mammograms?
A woman should get her first mammogram at age 35, and then starting at age 40, it should be yearly thereafter as long as the woman has breasts.
Is there any danger in getting mammograms because of the radiation?
No, the radiation doses for mammograms are less, and they're more of a computer-generated image, and so the risk of radiation versus the risk of not finding a cancer is very low.
Now, we have all thought that underwire bras could actually give breast cancer. Is that true?
That's absolutely not true. I don't think our government would allow underwire bras to be on every shelf in every department store, so that's absolutely not true.
What about deodorants? Do those contribute to breast cancer at all?
No, deodorants don't contribute to breast cancer. The reason why we tell women not to wear them just before their mammogram is because they have metals in them, and those metals can show up on the mammogram as something concerning.
Now, for those that have a family history of breast cancer, are they at a higher risk?
Yes, women that have a family history are at a higher risk, but the reality is any woman that has breasts is at risk for breast cancer.
As far as other information, what about women that are scared to go have their mammograms checked out? How can they overcome that fear? How can they, get into checking that regularly?
I mean, the reality is that only about 80% of the biopsies that we do are going to be, 80% of the biopsies that we do are going to be negative. So that means only 20% of those are going to be positive. So those are actually very good odds. What I tell women is if you get a call back on your mammogram, it doesn't necessarily mean there's anything bad going on. It just means we need to get a better picture or to get a sample of tissue to really tell you what's going on.
And what is the correct information on hormone therapy after menopause and breast cancer?
For women that have been diagnosed with breast cancer, we recommend that they not be on hormonal therapy, or if they have a very high risk for breast cancer. If someone's going to be on hormonal therapy, we recommend that it be limited to about 5 years, and then after stopping it, the risk goes back down to that in the normal population.
Well, thank you. That's some valuable information. I'm sure our viewing audience, as well as the audience we have in the studio, can definitely learn from that. Now, I'm going to go to Yusef, the obesity expert. So tell us a little bit, what is the difference between overweight and obesity?
Okay. Well, there's some general standards. One standard we go by is the BMI, body mass index. Over 24.9 is usually overweight. Obese is over 30. I don't like to go by the BMI standards. Obese, also, we can translate that from a body fat perspective. In general, women become obese when they're above 30% of body fat, which is composition. So we're not just looking at height and weight. We're looking at what's the composition of fat in the body. And that's what's really going to cause, that's what the obesity that's destructive, that causes the disease, that excess body fat. For men, we're talking about above, it varies 23, 22% is going to become obese. Overweight will probably, for women, from a body fat perspective, will be somewhere between 27 to 29.
What about someone that doesn't want to go into all the percentages? Is there an easier way we could understand this?
Okay. Overweight. But generally, when they do define, you're talking about when they do define body fat, usually they use the BMI standards.
Okay.
But that's something that that's a dialogue that we have to have now, to tell people that physicians, we need to learn that it's not about BMI. It's not about height and weight so much, because that doesn't really tell you what's going on inside of the body, where that fat is being stored, and is it close to the heart, is it extra? So I encourage people, and I know it sounds technical, but to look, or challenge the physicians to look at the body fat composition in association with the BMI. I know that probably didn't make it any simpler, but I'm fighting. That's the battle I'm fighting. So,
Would you say obesity is prevalent in the Black community?
Yes, definitely, particularly among African American women. It's actually a disparity among African American women. Now, it's actually a disparity for all Americans, I mean, if I can use that word, but it's not. But it's actually a problem for all Americans, obviously. And so it's pervasive there. But particularly among African American women, also Latino children, and also African American children sometimes too. That's where the disparities lie.
What about the people that say that obesity is actually encouraged in females in the Black community? My man likes me fat, and I'm going to be that way. How can we, go about fighting that or overcoming that?
Right. That's something it's a tough thing to do. But one thing we can do is we can look at it from a medical perspective. I mean, the statistics don't lie. When a person, now there's a lot that we have to change here, but we have to become proactive about our health. So we have to keep bombarding people with the message that aesthetics are not as important as what goes behind that. What could possibly help is the men. The men African beginning to understand, becoming more health conscious. Families becoming health conscious and putting priorities on what
So it's something that we all as individuals and as a community need to come together and actually work on. Much. Okay. Yeah. Well, thanks for the valuable information. Of course, the amount of time we have is not enough to discuss the topics, but we have to move to Ms. Sharon Hawks. And tell us, what is the difference between a registered dietitian and a nutritionist? Is there a difference?
It's a very good question. There's a big difference. Most people don't know that as a registered dietitian, we're required to go through an accredited university, 4 years, go through a medical internship, take a registration exam, and all that must occur before we can even become a registered dietitian. A nutritionist can just decide one day they want to study nutrition and become a nutritionist. Okay, so what you need to make sure is that behind the name they have RD. The good news in the state of Maryland and in the surrounding states, they require that registered dietitians be licensed too as well, like physicians. So the good news for you here is that if you're seeing a nutritionist, they should be a registered dietitian as well. You're going to see RD behind their name, and also perhaps LD as well, stating that they're a licensed dietitian nutritionist.
Now, some people might wonder, why do I need to see a registered dietitian? What do you have to say to that?
Well, one of the things I think the reason our profession is so important is we're not just looking at weight loss. We're looking at nutrition as a whole. As you know, the whole issue of health relates a lot of time to our lifestyle, particularly exercise, as Yusef know, and also in the area of nutrition. Unfortunately, we as Americans spend so much time trying to figure out how to lose weight, and we spend billions of dollars a year going around to all different programs trying to accomplish that. When the reality is, everyone is unique in how their issue is. So when I sit down with a person on an individual basis, I'm able to ascertain what your strengths and weaknesses are as it relates to nutrition and wellness. And with that, we're able to come up with a plan that's specific for you. And also addressing the medical needs. As a medical professional, I can also address hypertension issues, issues with heart disease, even they're reducing their risk for breast cancer, lifestyle changes. All those things we're able to do as dietitians, not just about the weight.
Now, one last and important question is, you see people at the grocery store looking at the cans and I'm not sure I really know what I'm looking for. What should we really look for when we look at the ingredients in foods?
Well, it depends on what you're looking for. If you have hypertension, of course, we're going to be looking at the sodium content. The American Heart Association recommends that Americans take in 2,300 milligrams or less of sodium a day. You may not realize that's only a teaspoon. Okay, a lot of times we say we don't use sodium at the table, but it's already in the food. So I challenge you to take a look at the labels. You'll be shocked what you'll see there so far as milligrams of sodium. Also, you want to take a look at the fat. What we're talking about nowadays is trans fats. You've heard a lot about that. You say how much trans fats should be an item? 0. Okay, to make it very simple for you. So those are the areas you're going to start. And also fiber. We're always trying to increase the fiber in the diet. So take a look at that too as well.
Thank you so much for that great information you just shared with us. And like I said, of course, we don't have enough time today to discuss all the health issues, but we'll try to touch on as many issues as possible. Now, Dr. Robinson, tell us, what is heart disease?
Well, when you look at heart disease, I think a better term would be cardiovascular disease, because most people think of heart disease as just having a heart attack. But if you go from head to toe, you look at stroke, that's a cardiovascular disease. Blockage in the neck artery called the carotid artery, that's cardiovascular disease. Heart attack, congestive heart failure, people may have heard this term congestive heart failure, that's a weak heart. High blood pressure is considered a heart disease. High cholesterol. You can even add diabetes as a heart disease because it's what we call the cardiac risk equivalent. Blocked arteries of the legs, you may have seen some of the commercials about PAD or peripheral arterial disease, that's a cardiovascular disease.
And what are some of the risk factors associated with heart disease?
Some of the risk factors, you like to divide them between modifiable risk factors and non-modifiable risk factors. The non-modifiable risk factors are those you can't do anything about your genetics, your ethnic background, nor your gender. So those are some of the non-modifiable risk factors. The modifiable risk factors are what Yusef and Ms. Hawks discussed about our lifestyle, diabetes, smoking history, being overweight, sedentary, or not having any exercise at all, and some of those other factors that can come into play.
And who is more at risk for heart disease, men or women?
Well, we're both, actually.
Okay.
It's the leading cause of death in this country and many other industrialized countries. And one of the misconceptions is that women don't get cardiovascular disease or heart attack. Every year since probably 1818, when the cardiovascular disease has led everything else outside of the epidemic of the influenza virus, women have died from cardiovascular disease. So it's the old thinking that only men get heart disease, but that's not true. Women get it, but when they get it probably more severe, because it's been in the past in the training that, they have the hormonal coverage and they may get it later in life, so doctors may ignore it or may not understand the warning signs in a woman over a male.
I want to thank all our doctors and experts for being on the show today, and we're going to be taking questions from the studio audience later on in the show. But first, we talked to a heart disease and breast cancer survivor. This is their story.
My name is Jacquie Smith, and I'm a breast cancer survivor. I didn't have any warning signs. I have always had my breast exams from the time I was in my 20s with my gynecologist. And I followed through when it was time to have my mammograms faithfully, never missed one. I did have some fibroids, which I knew about, that kind of ran in my family. So they were benign, so I wasn't worried about those. I was in complete shock. It was totally unexpected. I didn't have a history of it in my family. And so it was just, very shocking to hear. And so immediate fear came in. And I went through, I guess, all the emotions that anyone else goes through when they're diagnosed with cancer. But I was pretty much walking in slow motion, from the first moment that I heard it until I got a lot of support that I needed. In my case, because I was going to have the breast removed, I did not have to have radiation, which is one of the treatments that a lot of people have. But I did have to have 4 sessions of chemo. again, because mine was detected early, I didn't have to have as many sessions of chemo as some other people did. And the dosage of the chemo wasn't the same as others. And one of the things that I found out was that it was so important to not try to compare yourself with the other patients, because each case is unique. And so the treatment and the how you'll feel as you go through the treatment will depend on your body and the type of medicine that they're giving you. It was difficult for me in terms that I was just terrified. What helped to get me through it was the great doctors that I had, and not only were they professional in what they did, but they had a component to it that made you feel like a person. And if you needed to be held, you were held. Whatever you needed, it was there for you. The great family support system. I was never at a doctor's exam without family members there. And I think the support is what really got me through it. You know, like I said, I was terrified, like everyone else was too, but I was hopeful because I knew I wasn't alone. For women who are going through breast cancer treatment, I would encourage them to stay hopeful, to know that you don't have to go through this alone. There is an amazing support system there for you, and to just stay hopeful and take one day at a time. When I was going through my treatment, although I said I only had to have 4, with each one I'd say 1 down and 3 to go. 3 down, 2 down and 1 more to go. Something like that would get you through it, whatever it takes to get you through it. But just really to just stay encouraged that you will get through it.
My name is Patty Markos, and I'm a heart disease survivor. It wasn't detected until the onset of my symptoms, although I guess in hindsight, with the family history that I have, my grandparents on both sides, my father who ended up dying of heart disease, and my mother who ended up on the heart transplant list, I probably should have been checked a little bit before that. But I was young, in my 30s, so I just thought I had some time before I'd have to start looking into that. Well, I woke up in the middle of the night with, your standard shortness of breath and chest pain. And after seeing my father have about 5 heart attacks, it definitely alarmed me. Well, in my case, genetics definitely plays a big role. I was also on the birth control pill, which it does say in fine print, if you have a family heart history, to not necessarily be on the pill and pick another form of birth control. And I didn't do that. And I did find out later also that I have a thyroid problem, and I have mitral valve prolapse. But aside from those things, it's really a very highly preventative disease and highly curable. It's lifestyle, and a lot of people are just eating high-fat foods, not exercising, stress, smoking. I did have a lot of stress in my life at that time. My husband was traveling, and I had a small baby and a toddler, and dealing with all of that and working at the same time, I was under stress. But in most people, yes, stress does elevate your blood pressure and contribute in other ways as well. Well, with heart disease, depending on the severity of your blood clotting and cholesterol, like I said, and blood pressure, basically for me, just taking baby aspirin every day. I don't need a prescription for that. My mother, on the other hand, she had waited to go to the hospital. She sat in bed in a chair all night long in denial that she wasn't having a heart attack. And she waited so long that so much damage was done to her heart. And the only reason why she ended up in the hospital is because she worked at the hospital, and she went to work that morning and was just telling her friend, one of the nurses, what she was going through, and they said, "You better go admit yourself." She did end up getting on a drug called Coreg, and that really helped a lot. She was put on the heart transplant list because she waited so long and it did so much damage to her heart. And it could have, she wouldn't have had to then if she had gone right away. I think early detection and going right away is so crucial. Those first moments of experiencing it, it's just a shame, you know, when people don't err on the side of being safe and go right away. I think for me, it was really important, but I guess more just the support that I had in people and just, you know, that they were going to see a difference in me and to expect a change in my lifestyle as well. I didn't have as many ingrained lifestyle habits that needed to be changed as much as as my parents did in their generation. Just things were different. I think that before my father died, if people would have been a little bit more encouraging to him, it probably would have helped as far as like going out saying, hey, let's go play tennis, let's go play basketball, let's go for a walk, get him out and exercise. And I think it's important too, if you go out to eat with someone and you're eating with them and you know that this loved one has changes that need to be made, don't eat the foods that they can't eat. Eat the foods that are going to encourage them and not tempt them. And, you know, I think with him, you know, my father had gone through bypass surgery a couple times, and that, you know, they can go through depression, and I think encouragement's very important, and I think just to be there for them and to just encourage them as best you can.
My company is about health and beauty, and the product line is called Body Magic Two-Step System. It's designed by an orthopedic surgeon who basically is addressing from a health perspective the fact that a woman's body needs to be upright, organs in place, spine straight to be able to operate perfectly. And then we have a complement of natural supplements that's about putting good things in to get things out. The premise of it is that this Body Magic piece drops you 2 to 3 dress sizes within 10 minutes, thus giving what we'd like is a instant gratification, boosts our self-esteem, lets us see how we will look, and then begins to set us on a path of using a progression of garments that then complement our body types and our body issues. Takes us through a process. There are different ones that you'll use for shaping, one for weight loss, some for shaping, and then if you're not interested in losing any weight, but you just want to be upright, straight, tight, look good in your clothes, this would also be a product that you would use.
Welcome back to Access to Healthy Living. If you are just joining us, we are at the 6th Annual Health and Fitness Expo here in Silver Spring, Maryland, and we've been getting some good information from our health experts that we have today. Now it's time to take questions from our studio audience, so if you have any questions for our experts, please step up to the mic.
Hello, my question is for the doctor. Is it Dr. Hampton? Okay, I am a survivor of 2 years for breast cancer, and I am currently on a Remedex for the next 5 years. My question is, what would be the determining factors that would come into play to say that you'd have to stay on it longer, or whether or not you'd have to go the full 5 years? Can you answer that?
Well, when I was speaking about the 4 to 5 years, that was for hormone replacement for women going through menopause. Okay. So there's some women, because their menopause symptoms are great, they're getting hot flashes, they can't sleep, we'll put them on an estrogen replacement. Mm-hmm. The Arimidex that you're on is actually protective for you and helping to prevent a future breast cancer. So your oncologist will speak to you at the end of the 5 years and determine whether you should continue on that medication or if they'll make a switch to a different medication.
Okay, thank you.
Good morning, everyone. I have two questions, if that's possible. One is for Yusef. We've heard historically so many times people saying, well, my family is historically overweight or obese. I'm not meant or fit to be, a size 2 and a size 0. Is there any truth to that, or is it possible for anyone and everyone to be, at a moderate or petite size?
Well, you're right. Everybody is unique. And now and as I was saying before, there's the health side of things, where if we know that your body fat percentage is a little bit higher than what it should be, or takes you out into a zone that's typically will cause whatever's in your medical history to come to roost because of excess body fat, that's when we have to be more concerned. But outside of that, if you're in a tone zone, there's a wide tone zone to be in. You could be healthy and like the way you look at 13% body fat, and that could be, I know I'm giving you the numbers here, but you get the gist here. Or a person could be 25% and still be healthy, which means they can have a little bit more on them, and like it that way. But more importantly, it's understanding that you don't want to necessarily look like what the tabloids are telling you with Beyonce and everybody else. Your goal will be to be your personal best, your healthiest, and then the aesthetics come. I hope that helps.
Yes, thank you. Dr. Robinson, what are the differences in symptoms for women with cardiovascular disease versus the men?
The symptoms may be a little different for women and men, in particular women with diabetes, or men with diabetes, but in particular with women, they may be more subtle. You always read about an elephant sitting on the chest, going up the neck, going down the left arm, but that's classic. In women, it may be just shortness of breath. You could do an exercise one week, but then when you do the exercise the next week, you become more short of breath,